most common cause of diarrhea and vomiting is acute infectious gastroenteritis, which is a stomach virus, is the most common cause. There's other uncommon causes. Sometimes bacterial infections can cause it, or surgical problems in the abdomen can also cause it. The biggest concern that we get is if kids are getting dehydrated from the vomiting and diarrhea that they're having and potentially ending up with electrolyte imbalances on top of the dehydration, or if potentially we think something else is going on besides just a straightforward stomach virus being the cause. The signs that we look for are that they're not acting the way that they typically do, so that they're having decreased activity, starting to act lethargic, that we were noticing that their lips look dry, their mucous membrane, so inside their mouth is also looking sticky or starting to look dry. Their eyes start to look sunken. If they're a baby, the fontanelle or their soft spot starts to look sunken. They're having decreased urine output, so they haven't peed for 6 to 8 hours. Their heart rate has gone up significantly. They're generally just not acting appropriately. The World Health Organization defines it as 3 or more watery stools per day, but in kids, they may have kind of 3 or more stools a day anyway when they're an infant. So typically we define that as having kind of twice as many stools as normal that are loose and watery. We want to make sure that they're continuing to drink fluids. You don't need to alter their diet a whole lot, but do want to avoid fatty foods because those are more difficult to digest. And then also avoid real sugary fruit drinks because that may also upset their stomach and cause more problems with the diarrhea. In kids that are breastfeeding, typically breast milk is still going to be the best thing for them to feed. So if they're breastfeeding, still continue to breastfeed them. If they're not obviously breastfeeding as well, that's a sign for concern. When you're noticing large amounts of mucus in the diarrhea, or anytime you see blood in the diarrhea, you definitely want to call the doctor at that point. If you're concerned that your child is getting dehydrated from all the diarrhea, call them then. If your child's having a lot of severe belly pain, not just a little bit of crampy pain, but they're having a lot of belly pain, definitely call them then. If they're acting lethargic, so they're having decreased level of activity, they're just not acting like themselves. To care for a child with vomiting at home, you'll care for them fairly similar to a child with diarrhea, that the biggest key is to keep them hydrated, and with children that are vomiting, the key is to give them small amounts of fluid frequently, because if you give them a large amount at one time, they may be more apt to want to vomit that back up. Using commercially prepared orally rehydrating solutions such as Pedialyte tend to work pretty well for kids that are vomiting to help keep them hydrated because of the amount of sugar and salts that are in them. For kids that are tolerating foods, you'll want to stick to things that don't have a lot of fat or sugar content in them because they tend to be more well absorbed. For babies, again, breast milk will probably be the best bet. If you notice any blood, which in vomits, that can look bright red, or can also be a dark brown or even coffee-colored appearance to the vomit. Or if there's anything that looks like bile, which is a really dark green color to the vomit, that would be a reason to come in. If they're having severe belly pain, or their belly seems like it's getting distended, getting much bigger than it typically is, that would be another reason to come in. Or if they're showing signs that they're dehydrated. One of the biggest steps is definitely hand washing, that when one person is sick with acute gastro, that other people potentially can get sick from that person spreading it. So good hand washing, especially after using the bathroom or changing someone's diaper. The other good thing that parents can do to help prevent their babies from getting sick is using the rotavirus vaccine for their babies. That's a vaccine that has been recently developed in the last few years to help prevent rotavirus, a specific type of virus that causes infectious gastroenteritis.